Good morning, everybody. Today, our topic is fluoride toxicity. In this class, we are going to discuss about the classification, acute fluoride toxicity, characteristics of toxicity, chronic fluoride toxicity, dental fluorosis, affected skeletal tissues, other toxic effect of chronic excessive fluoride ingestion, treatment for fluoride toxicity, concentration of fluoride, and fluoride effect. First, we will classify the fluid toxicity. Fluid toxicity can be classified into two types. One is acute fluid toxicity, and the other one is chronic fluoride toxicity. When you take a acute fluid toxicity, it is uncertain to say rightly what is the acute fluid toxicity because it's based on the various observations. 5 to 10 grams sodium fluoride would certainly be a fatal for a person with a body weight of 70 kg. The dose range for adults would be 32 to 64 milligram fluoride per kg. So dentifrices, some countries, dentifrice usually contains 1000 ppm. It may even contain up to 1500 ppm in case of Europe, and even up to 2500 ppm because of easterly concern. ppm is a parts per million of fluoride content in the water. The fluoride mouth rinses are available in the USA. The fluoride content up to 18 ounces or 532 ml. This quantity is 2.5 times the PTD for a 20 kg child. The 1.23% of gels, fluid gels, and the 1.8 standard fluid solutions are clearly hazardous to the health of young children or even adults. There is a life-threatening hazard in case of 0.5 or 1.0 milligram fluoride tablets. The characteristics of toxicity. What are the characteristics of toxicity? When you take up the characteristics of the toxicity, there is a GAT, gastrointestinal nausea, vomiting, diarrhea, abdominal pain, and cramps. When you take a neurological, paresthesia, paralysis, tetany, CNS, nervous system, depression, and coma. Cardiovascular system, weak pulse, hypotension, pallor, shock, cardiac arrest, and ultimately the cardiac failure will happen. So blood chemistry, acidosis, hypercalcemia, and hypomagnesemia. So these are the characteristic features of the fluoride toxicity. When you ingest excess amount of fluoride, it affects all the system, GIT, CNS system, cardiovascular system, and blood chemistry also get altered. So some other non-specific symptoms. There is no symptoms, but that is not much important. But non-specific symptom also includes the fluid toxicity, which includes the excessive salivation, tearing, mucosal discharge, cold wet skin, and conversion. And apart from that, we have the myopathological signs. What are the myopathological signs? Declining plasma concentration, rising plasma potassium levels, the pulse may be thready or non-detectable, blood pressure may fall, respiratory acidosis will diminish the pH gradient across the most cell membrane, cardiac arrhythmias, coma, and finally death may happen. These are the myopathological signs. So these are the some toxicity symptoms of the fluoride toxicity. So this is called acute fluoride toxicity. Next, we will go to chronic fluoride toxicity. What are chronic fluoride toxicity? What are the effects? So it causes dental fluorosis and skeletal fluorosis. Dental fluorosis is more than 2 times the optimal level. The optimal level is we can say 1 ppm in 1 liter of water is the optimal level. If it is more than 2 times, until the 5 years of age, the child consumes the excess fluid water up to 5 years, then it leads to dental fluorosis. But the 10 to 25 milligram per day, every day, the person consumes more than 10 to 20 years, then it leads to skeletal fluorosis. So this classification, the chronic fluid toxicity, we can classify into dental fluorosis and skeletal fluorosis. When you take a again, the chronic fluid toxicity is a result from the long-term ingestion of small amount of fluoride. Okay, whereas the dental fluorosis, it is an endemic disease in geographic areas where the contents of fluoride ion in the drinking water exceeds 2 ppm. So it is an endemic, one particular area only the fluoride, excess fluoride present in the water. Okay, so it's a defined area. So this is called an endemic disease. Where the kind of fluoride ions in drinking water exceeds more than 2 ppm. The enamel fluorosis is a development phenomenon. The excessive fluoride incident during amylogenesis, the two development stage, there is a stage called amylogenesis. That time if the excess fluoride ingestion occurs simply within the dental arches. So there it leads to amylogenesis. It affects the amylogenesis stage. So it leads to dental fluorosis. This was first classified by the Dean in 1942. Dean's fluoride, that's why we call it the Dean's fluoride index also. As a result of this, there will be lusterless, opaque white patches, mottled, striated, pitted. The mottled areas may become stained yellow or brown. And hypoplastic areas may be also present. Sir, identified the Pemberg in 1970. He coined the mottled enamel. Then dental fluorosis in India and its feature. The chronic effect of fluoride in the skeletal system was well described in India from the state of Madras as early as in 1937. During 1937, itself Short et al. They conducted a survey and they described about the effect of dental fluorosis and the chronic effect on the skeletal system. Was described in 1937. There are some states, Punjab, Haryana, Rajasthan, Gujarat, Madhya Pradesh, Andhra Pradesh, Tamil Nadu. These states are affected badly by the dental fluorosis and even skeletal fluorosis in those days. The skeletal fluorosis features include severe pain in the backbone, joints, hips, stiffness in joints, spine, outward bending of legs, hands. These parts lose their shape and control. So it severely affects the bone present in the backside, the spinal cord, the backbone, joints, hips, stiffness in joints and spine. So this is also called as a knock-knee syndrome, so skeletal fluorosis. So these are the certain examples and photographs that are affected. The lock-knee syndrome. This is a, if you see the legs, so bend leg become bending legs. So the spine got affected. So we can appreciate the skeletal fluorosis. Next, other toxic effect. Apart from the dental fluorosis and the skeletal fluorosis, there are other effect also, toxic effect also occurs in the body when you're taking excessive fluoride. So it leads to crippling fluorosis. Fluoride can also damage the fetus. The mother consumes excess fluoride during the pregnancy. Fluoride may lead to blocking and calcification of blood vessels, causing cardiac problems. The fluoride dosage necessary to this pathologic skeletal fluorosis is estimated to 20 to 80 mg fluoride per day for a period of 10 to 20 years. There again the neurologic manifestations. So these are the apart from the dental fluorosis, skeletal fluorosis, these are the other toxic effects of the excessive fluoride ingestion. So treatment, what we can do, the treatment for the excessive fluoride ingestion. Excessive fluoride ingestion, vomiting should be induced by giving the emetics. 1% calcium chloride or calcium glucose may be given. The milk also you can give. Otherwise, next day, in case next we have to take the patient to the hospital emergency department. This is the management of the excess fluoride injection, sudden fluoride injection. Some concentration of fluoride and their effect. Concentration of fluoride. Suppose the fluoride ppm means parts per million in a water, 1 liter of water. 1 ppm parts per million of fluoride present in the water, drinking water, it helps us in a dental caries prevention. Whereas if it is present 2 ppm, it affects a vegetation. Whereas 2 ppm or more, if it is present, then it leads to mottled enamel. It affects a dental structure, tooth structure. 5 ppm, if it is got a 5 ppm, then there is no osteosclerosis. More than 8 ppm, 10% of osteosclerosis start in the bones. 50 ppm in case present in the water and the person is consuming, then there will be a thyroid change will happen. 100 ppm leads to growth retardation, that is will affect the growth. It's more than 125 ppm, it changes the kidney, it affects the kidneys. 20 to 80 milligram or more every day, per day, if you are drinking, it leads to crippling fluorosis. That is locked-in syndrome, what we say before, that crippling fluorosis may happen. If it is more than 2.5 to 5 gram, then it leads to death. So here we should, apart from the toxicity, we should know the dosage of the fluoride. So CLD means it's a certainly lethal dose. That is CLD, that is 5 to 10 gram of fluoride. STD means safe tolerated dose. That is 1/4 of CLA, that is certainly lethal dose 0.4. PTD means probable tolerated dose, that is 5 gram of fluoride is a probable tolerated dose. So this is the fluoride toxicity. So we can classify fluoride toxicity into acute fluoride toxicity and chronic toxic fluoride toxicity. The acute and the chronic, there are two types of fluoride toxicity. In this, the dental fluorosis and skeletal fluorosis is very much important. The normal level of fluoride is 1 parts per million. If it is excess more than 2 ppm, then it leads to mortal enamel. These are the information we should know. As a dentist, we should aware about the thing. Thank you.